warn people that if they get kicked off to come back into the window.
Okay.
And that it's a weird platform.
Okay, we are now live. Thank you, everyone. I apologize for the few minutes delay. We're all still working through this technology, and I unfortunately had to switch locations. So, but welcome, and thank you for joining us today at all of the League events, but particularly this particular workshop, Where Do We Go From Here? The Rhode Island Housing Market and Creation of Equitable Housing After COVID-19. That's a mouthful, but we've got a lot to get through and talk about today. But first of all, I'd like to welcome and invite our session sponsor, Mr. Offenberg, and my apologies if I'm mispronouncing that wrong, sir, to welcome you and ask you to tell us a little bit about your company and also your interest in this topic.
Excellent. Thank you so much, Brenda. My name is Eric Offenberg. I'm the Managing Director in Rhode Island for WSP. We're very proud to be a sponsor of the convention as well as this particular topic. WSP is one of the world's leading professional services company. We've got over 50,000 employees throughout the world. We have thousands of employees throughout the Northeast region, and we have an office right here in Providence, Rhode Island, where we have many of our professionals. We are engineers, we're architects, we're planners, we're environmental specialists, we're grant writers, we're program specialists. We do all the services necessary to help municipalities, to help nonprofits, to help private sector clients really put their projects together. WSP has a strong history of working in affordable housing projects for both public and private sector clients. We've done, major high-rise developments in cities to spread out housing projects in diverse communities to really looking at equitable and sustainable projects, throughout these areas. So, we like to think that we're your partner in providing, equitable and sustainable affordable housing throughout the area. So we're really excited to be part of this. I personally actually own affordable housing projects. I'm very familiar with Section 8. It provides an incredibly valuable service in property for people that can't otherwise afford it. So, I live and breathe this every day. I'm so excited about this topic, and WSP is really, really happy to be, participating with you all. So thank you very much.
Well, thank you, and we very much appreciate the support and your willingness to be here today. As we'll talk about throughout the session, COVID has certainly highlighted the need for safe and affordable housing for many people. You can't shelter in place, you can't socially distance, you can't do distance learning without that safe place and safe place to call home. And so very appropriate that we're talking about this topic today. So just a reminder, this is a new platform for many of us, and as you can see from the delayed of me getting in, still learning on this front. Poor Annette, she made me practice too, and I still got it wrong, Annette. So I don't know what happened, but I'm here finally, and glad to see our rest of our panel here. Most everybody, I think. So I'm going to turn it first, and I'll introduce them to talk. I'm going to turn first to my colleague Annette Bourne, who is our Research and Policy Director at Housing Works Rhode Island. Housing Works, as I think Annette will talk briefly about, is a research and policy organization that looks at all things housing in this state, and we work with our colleagues throughout the country on housing issues as well too. And so Annette will talk a little bit more about some of the work that we're doing and kind of set the frame. I will also remind people, because this is a new platform, and I know I experienced myself, I got kicked out at least once or twice trying to sign in. If you do get kicked out of the workshop for some reason, please just kind of click back in and just be patient with the technology as well. So with that, Annette, I'll turn it over to you. Oh, I'm sorry. One more thing, Annette, just to for folks as we go through presentations, we'll try to hold questions until the very end, but there is a feature where you can add some questions in, and we'll monitor those when we get to Q&A time. So, Annette, take it away.
Thank you very much, Brenda. Good morning, everybody. Good afternoon, everybody. I'm going to go ahead and share my screen. And Nope. My entire screen. Yes. Application window. Oh, there it is.
Amazing
Through
how
COVID,
quickly we've all learned that's all
through
good stuff.
yes, through COVID, we are just becoming so technically aware. Okay, so good afternoon. Thank you for joining us today. I'm going to present an overview of housing affordability, equity, and the role of municipalities playing in helping to achieve a better landscape for housing as we emerge from COVID. For those of you who don't know us, Brenda just gave you a little bit about us, but I do want to let you know that we do try to connect the dots of housing between economic development, outcomes, and health and education. And we do this through our annual housing fact book. Please know there is a link for documents in this platform. If you go to documents for this session, you will see all of the presentations as well as the bios, as well as a link to our housing fact book. So due to COVID-19, the 2020 Housing Fact Book added facts about our state's racial and ethnic housing disparities, as well as information about COVID-related programs and relevant information. This is not something that we had ever done before. So what do we mean by housing affordability is where we will start today. Then we will go to creating equitable housing choices and the role of municipalities. So what do we mean by affordable? It basically refers to a federal housing definition whereby a household should spend no more than 30% of its gross income. For our state's median income of almost $64,000, that's about $1,500. For median renter, you're looking at less than $900. Think about that for a moment and think about the pricing of housing that you are aware of. If you spend more than 30%, you realize that you're not really able to spend money much on essentials like food, childcare, transportation, healthcare. It's a relative term. Obviously, if you are earning $100,000 a year, you probably can be spending more than 30% of your income and still afford some of those other things. And the lower you go, the less realistic the 30% is. Just a reminder that 60% of Rhode Island renter households below $12,765, that is the bottom fifth of our renter population, are severely cost burdened, meaning they spend 50% of their income on their housing cost. So there are two paths to affordability. One can be served by the market. We think of these as naturally occurring. Some of us call this little a affordable. Some people start using the term middle housing, although middle housing actually refers to an architectural type. It's reflected in a lot of our more modest neighborhoods throughout the state, although living in one of those, I can tell you now that even my neighborhood here in Cranston are seeing prices creep up toward the 300,000 mark. The other category of affordability is what is considered long-term affordable. The long-term nature of these are created by a subsidy from the federal, state, or municipal government. It has some sort of a legal restriction on it, whether by deed or land trust, and by state law, this is what is considered our low and moderate income housing. And each municipality should have a goal to achieve at least 10% of their stock to fall into this category. Under long-term affordable, there are two ways of creating it, either through direct rental assistance, such as public housing, which we don't develop anymore, or capital assistance to the developer, such as the developers on our panel today, who will receive a direct subsidy in exchange to maintain the affordability to a certain level of income. These next slides come directly from our 2020 Housing Fact Book. The data is for 2019, so we will have new data coming out soon. You can see the story here. Prices are higher than what incomes really generally can support. And on the right-hand side of the slide, I've inserted what our 2020 prices for single family and multifamily are. And they have already, as you can see, 12% increase in single family pricing, multifamily almost 15% increase. And so going back to affordability and thinking about how many households really can't afford the pricing that we currently have, statewide, we're over 145,000 households that are cost burdened. This amounts to 49% of renter households, nearly a third of owner households. When you think about the minimum of 10% long-term affordable housing, you can see that that really barely scratches the surface of what is actually needed. Then we had COVID-19. The pandemic has highlighted the importance of stable housing for health and well-being and exposed consequential inequities in our communities. Without access to safe, affordable places to live, households cannot isolate safely. Long-standing disparities in housing security are among the factors which have led to a disproportionate impact of the virus on people of color especially. Despite decades of warnings from housing researchers and advocates, fragile home security is clearly compromising our ability to control the virus and stabilize our neighborhoods. Investment in housing supports has never been more needed. So, in this post-COVID reality, more people have become familiar with the concept of equity. Just as I noted the term affordable is a relative term, the concept of equity takes into account the differences that may be needed to achieve the positive result, just as illustrated in this slide. What we knew before COVID has become apparent to more people now. Your zip code is a better predictor of your health than your genetic code. This is a quote from Melody Goodman at the Washington University in St. Louis. Maslow's hierarchy of needs, for those of you who remember this, shelter, food, and clothing are your most basic physiological needs. And housing advocates see housing as the axle, if you will, to many of life's outcomes. Brenda is fond of saying opportunity starts at your front door. As pointed out earlier, creating homes that fit a resident's budget also allows them to spend more money locally, supporting goods and services. So the social determinants of health is a concept that was created by the World Health Organization, and we'll be talking more about this in the future slides. Of late, the most common concept regarding equity relates to race and ethnicity, which have become more widely acknowledged, especially since the pandemic. In the 2020 Housing Factbook, we note a number of these, including the significant disparity in homeownership rates between those who identify as white versus other racial and ethnic groups. Whites in Rhode Island have a homeownership rate of 67%, where Blacks and Latinos are at 33% and 29%, respectively. As it relates to geography, approximately 80% of Rhode Island's Blacks live in only 6 municipalities in and around Providence. And I'll remind you, we have 39 municipalities. Some important notes, I'll go back one. Some important notes about how we got here, though. Many of these outcomes were predictable based on a number of federal measures that date from the 1930s to the 1950s. After World War II, the disparities perpetrated by redlining, FHA eligibility, urban renewal, and public housing eligibility became more noticeable and examined from a legal standpoint in an important book by Richard Rothstein titled The Color of Law. Though some laws in the 1960s sought to ameliorate these effects, like the creation of HUD and the passage of the Fair Housing Act, there have been challenges living up to those laws. In the 1980s, we saw an elimination of new public housing and Section 8 developments, with a significant increase in people experiencing homelessness. There was also a drift toward tax credit programs like the low-income housing tax credit, which set rents by income eligibility, and away from rental assistance, which sets rents according to 30% of a household's actual income. Inequities are not only captured by race and ethnicity. As we have discovered the importance of place, there have been more of a conversation about equity. Another way to think about equity is relative to what opportunities are available to live up to your potential. These ideas have been captured more recently by livability and opportunity and are measured by a number of indexes supported by a growing number of research and advocacy organizations, some of which are here on the slide. Basically, they will account for things like schools, jobs, transit, and questions like, are there fresh foods nearby, good health care, parks for walking? For those of you who are data geeks like myself, I can tell you now, these websites are a bit addictive because you can type in your address and look at your community in many different ways. So the fundamental question, how do we move forward in a more equitable way? First, the concept of equity is being discussed across Rhode Island, especially as it relates to disparities in health outcomes. 3 cities, the ones in bold, were also awarded funds through the Federal Reserve Bank of Boston's Working Cities Challenge. All of these are grassroots efforts led by residents and stakeholder organizations that offer guidance in the implementation of more equitable policies. Please do know, being locally run, these initiatives are often already kind of overwhelmed, so be kind when you approach them, and if you have means of funding the work that you're asking them to do, please consider that as well. Secondly, while the Rhode Island housing ecosystem is complex, as you can see on this slide, the partners are varied and accessible throughout the state and within public and private sectors. To create more housing choices that meet the needs of various Rhode Islanders, please consider each of these types: market rate affordable stock, long-term affordable stock, and supportive stock, which would help for people experiencing homelessness. I apologize for my phone ringing in the background. These programs exist to help us meet the needs of Rhode Islanders at most levels of income, and they all follow guidance now that seeks equitable locations and outcomes. Last, the roles of municipalities in creating equitable housing. Planning and zoning, code enforcement, public works departments all have a role in this effort. As you consider the questions that pertain to planning and zoning, please think about what are the tools in your municipality's housing toolbox. What are the opportunities in each of your neighborhoods? Is there multifamily zoning by right? Residential near other uses, stores, parks, and recreational areas? Do the streets connect to each other? The Housing Fact Book actually contains this information for all 39 municipalities as it relates to the housing toolbox. Take a look at your own city and town. Think about what you can be doing if you're not doing everything, and speak to your residents and engage your planning and zoning officials. While municipalities have a key role, obviously our state does too. What is most needed for the developers you're about to hear from is funding. Rhode Island does not sufficiently invest in housing affordability. We are significantly outspent by our neighbors. We are the last in New England. Maine, which is second to last, spends more than double per capita at $41.47 per capita to our $20.45. And that was FY19. Before the last bond funds were spent. Before another bond is passed, we may return to below $10 per capita. We will have another opportunity to make these investments with the special election being held March 2nd. We urge you to vote yes on 3 for $65 million worth of housing and community opportunity bond for the construction and rehabilitation of affordable homes and apartments across Rhode Island, and to help communities revitalize neighborhoods through their development, new construction, and property acquisition. The SMART investment will leverage millions in additional resources while creating much needed housing, construction jobs, and stronger communities. How do we ensure more success than not? Federal, state, and municipal roles, providing funding, passing bonds, creating better planning and zoning, thinking of your comprehensive plan and adding equity into it is a good start. Many municipalities across the United States have been really thinking innovatively about how to accomplish housing affordability and overcome the long history of discrimination that has resulted in significant disparities. There's lots of ways to learn more. As I mentioned, these presentations are in the documents link. We're also happy to come to your municipality to give customized presentations. So with that, I will share my contact information. Thank you all very much.
Brenda, you're muted. We can't hear you.
Brenda, you're still muted.
I'm thinking we should probably introduce the next speaker. Sorry for the technical difficulties, everybody. Oh, we've lost audio totally.
No, we can still hear you, Annette.
Yes, but in the chat, somebody is saying there's no audio.
I think that's just Brenda. Annette, maybe you should introduce Elizabeth and we can get started.
Okay, I'm hoping our presenters, I'm hoping our audience can hear us. Okay, thank you, Jennifer. Thank you, Jennifer. Okay, I'm going to introduce Sharon Morris. To learn more about all of our presenters, please access the documents and see their wonderful bios. Sharon Morris is the Executive Director of Omni Development. She's a former colleague of mine from Rhode Island Housing as well, and she's just fabulous. So take it away, Sharon.
Good afternoon, everyone. Thank you so much for joining us, and I do apologize for our technical issues. I'm going to share my screen, so bear with me as I navigate this new process here. Hold on. Okay, can you see that? Can you see my screen? Share. Okay. All right. Okay. Can you see my screen? I just want to make sure. I'm still new at this. Can someone give me a nod or? No? Okay, let me try it one more time. Share. There we go. Okay, great, thank you. Sorry about that. Okay, Omni Development Corporation has been a developer of affordable housing since 1986. We are an award-winning minority-controlled not-for-profit community development corporation that's located in South Providence, in Providence, Rhode Island. And for the past 3 decades, we have helped transform some of Rhode Island's poorest communities, and we've replaced vacant lots and abandoned properties with some high quality affordable housing. I'm very pleased to say that we have developed over 1,200 units of affordable housing, apartments and homes throughout the state and in Connecticut as well. Our existing portfolio is very, very diverse. We have historic buildings, multifamily apartments, scattered apartments. We have apartment buildings and both large and small, and we also have single family homes in our portfolio. This picture that you see here is one of our most recent developments that we redeveloped in 2017 and 2018. We transformed this apartment community into this right here. This suburban family development has 122 units and it's located in Waterbury, Connecticut. And this just shows you our great diverse portfolio. We also have apartment communities in Providence. As you can see here, these are two of our apartment communities that we have in the city of Providence. We have some scattered site apartments throughout the city as well. These are some of our historic buildings that we have. The Whitmarsh building, the white building on the left, is one of the city's oldest apartment communities. And the building on the right is the old YWCA. We call this the 1890 house, and it's located in downtown Providence. And we also show you these are two of our elderly developments that are located in North Providence, Rhode Island. And I actually had the pleasure of managing these properties over 20 years ago. They're across the street from another. Omni Development Corporation, while we develop affordable housing, we have several funding partners that we are responsible for reporting to. We work with HUD for our Section 8 developments, which are family, elderly, disabled, and formerly homeless populations that we service. We have PRAC 202 senior developments. We have a historic building on the east side of Providence known as the Governor, which was an old convent home. And like Annette had stated, we no longer have public housing, so we also have units that are newer, some newer affordable housing under the RAD program, which is the Rental Assistance Demonstration Program. We work closely with HFAs located in Rhode Island and Connecticut. We work with the City of Providence with their Home Fund program. That's one of the funding sources that local municipalities can assist developers with when we are trying to develop affordable housing. So some of the towns, if you have some of these funds, this is a great revenue or a great stream of source of funding to help developers develop in your communities. And we also have equity investors known as syndicators for the Low Income Housing Tax Credit Program. So those are some of the partners that we are responsible, that we have to provide monthly, quarterly, annual reporting to for the over 1,200 units that we have in our existing portfolio. I wanted to share this this screen here with you to kind of just show you how stable our properties are. The property performance in November of 2020, we've been very lucky. You know, we have 17 developments, and in our 17 developments, our tenant delinquencies are probably 2% of our gross, delinquencies. Our vacancies are very low. In our entire portfolio of over 1,200 units, we only have 26 vacant units as of November 30th. So that's something that I really, really wanted to show and highlight to you. Just one moment, my computer came out of the outlet. Sorry about that. And last year, our properties, we performed pretty comparable. And we had developed 3 developments, 350 units under construction during 2019 that we brought online in 2020. But our delinquencies were a little bit lower, and our vacancies were pretty much the same. So I wanted to show you this comparison when you talk about the COVID impact on housing. Individuals that live in affordable housing are really doing what they need to do to make sure that they have a stable place to live. And that's something that we were all concerned about as we entered into this COVID pandemic last year. We were wondering how our properties were going to perform. And with the assistance of our management team and the staff that we work with, we're very pleased to report that our properties continue to perform well, and we do everything that we can to help our residents keep their housing. Some of the portfolio issues that we did experience during COVID as it relates to our properties and operations, we have many families that have children. We wanted to make sure that families had access to internet services, so we reached out to all of the families to make sure that they had internet services. If they did not have internet services, we provided valuable resources to them so that they can get low cost internet services with Cox. They had reached out to us. We worked very closely with them to try to get families enrolled. We were able to get computers donated to about 25 households that live in our developments who didn't have any computers and relied on the schools, Chromebooks or school computers. We were very pleased to be able to do that. We linked our seniors to meals services and other valuable resources to help the seniors during the pandemic. We made sure people had face masks and a lot of personal protective equipment to navigate this transition during COVID. And we also work with families to help them seek out resources to help with rental assistance, unemployment, COVID testing. We're actually working right now with working with our seniors to try to get them enrolled, to get their vaccines, to get them signed up. So we've really gone above and beyond to make sure that the tenants that we have in our units receive the services that they need. In addition to that, some unanticipated operational costs as far as cleaning and maintaining our buildings, our common areas, to make sure that the residents felt comfortable when they use our facilities. That was something that we hired additional cleaners to help with maintaining our properties during COVID. And then more importantly, we had to make sure our staff and our staff and employees that worked at our properties were okay. So with our management team, we worked out some of those services to make sure that the staff received the services that they needed to be successful. As it relates to development issues, because we also had properties that we were in the middle of construction. So we had a senior development. We closed last year in 2019. We were in the middle of construction. We started experiencing increased cost in supplies, primarily lumber. Our cabinets were delayed, appliances were delayed. So we had a lot of shipping delays, and our construction, the labor force, number of individuals started becoming sick and getting COVID. So we've had to stop construction, to make sure that the crews were taking care of themselves. So if tenants were sick and we had to relocate them to other units, that also impacted our construction schedule. And then safety. We had some safety concerns and costs that we didn't anticipate, but it was important for us to make sure that whenever the residents exited their apartments and went to a vacant unit and moved back into their apartment, we cleaned the unit before the resident entered back into their unit, before the construction workers started working in the unit, after the construction workers finished working in the unit, because we wanted to make the residents feel safe and comfortable, and we wanted the residents to know that we were doing everything that we possibly can to make sure that the units were clean and sanitized. Our future developments, right now we have submitted an application and we are trying to do our pricing based on the current prices, but our general contractors have made it very clear that the prices could possibly fluctuate. And like I stated before, the cost of lumber, it's doubled, and it went up, it doubled earlier on, then it went back down, but the price is still higher than it was a year ago this time. So those are some important issues that will affect future developments as we navigate the COVID pandemic that still exists today. This is just an example of the the various multifamily models that we showed you and the total development costs. So these are the costs per unit on the developments that we tried to develop in Rhode Island, and I actually forgot to add the Connecticut pricing in here, but this is the total development cost for, based on the various unit styles that I showed you all. And the urban construction is a lot cheaper than the other communities, but we really would like to be able to provide housing opportunities outside the urban corridor if that opportunity is available to us. And this is one of our proposed developments. And as you see on this previous slide, there are 3 different price points that I put pending project, because this development that we submitted an application for to Rhode Island Housing is a very competitive LIHTC round. I think they may only award 3 developments, and they received us triple that in application. So this is one of the developments that we submitted an application for, and it's a 53 unit building that we have. So it's one large unit, and as you can see, it's very top of the line. And when we designed this building, we did keep in mind the families that will reside here. We plan to have a community room with internet services, Wi-Fi in the common areas, and we're looking at trying to figure out how we can provide additional internet services to residents throughout the building. So that's something that we're still working through. One other thing that I'm pleased with is that during the COVID pandemic, a lot of people have to access their healthcare providers through the computer, telehealth. And in the community room, we plan to have some rooms, some private rooms that will be office space, but tenants will be able to utilize that, make a reservation if they need to schedule an appointment, use a computer to schedule an appointment with their physician. So those are some of the things that we're trying to adjust as a result of the pandemic, because we're able to access healthcare from our homes, but tenants don't have that luxury in some apartments. So we hope that this is a welcome addition to this property as we move forward with this process. And these are just a couple of other photographs of the other housing plans that we plan to develop with this project that we hope to be successful with in the next few months. And again, like Annette had stated, for us all to vote yes on 3 with this housing bond that's coming up, we really, really need these resources to help us continue the work that we do. Thank you so much for your time, and my contact information is here. Feel free to send me an email if I can be of assistance, or if you need to ask me any additional questions that you're not able to ask me during this presentation. Thank you so much for your time, and I'm going to Liz, you're up. Thank you.
Hi, everybody. Let me just get my screen shared here. Go. Okay. So good afternoon, and thank you, Sharon, for that thoughtful presentation. I'm glad that we have you covering affordable housing, as you are our affordable housing development partner on the project that you had just talked about, and we're also a management agent for Omni. And have a really nice working relationship on that front. So thank you for the presentation. Thank you for inviting me to present to the group here today. My name is Liz Schuster, and I'm a member of the Development Acquisitions team at Wingate. Wingate is a developer of affordable housing and market rate housing with a portfolio of 16,000 apartment homes. As we like to say, we speak 2 languages. And I've been asked to talk about how a development of mixed income and market rate housing is changing in a post-COVID world. And I'll be using our project 95 St. and Longwood as a case study for our discussion today. And that project is in Boston. And you can see the location here. This is the Longwood. This is the garage on which 95 St. is being built. So generally, there's been a shift from urban to suburban multifamily and single family development as a result of COVID. However, we continue to see and participate in development of urban locations where demand is driven by specificity of location. So a prime example of what I mean is 95 St. and the Longwood Medical Area location, which allows the buildings to take advantage of the fully staffed hospitals, setting them apart from a lot of the buildings in Boston that are struggling for occupancy today. So the Seaport's a really great example. Bostonians are no longer walking to the financial district to get to work. They might be working on their financial models from the beach or the mountains instead. Whereas 80% of the residents in 95 St. will work on site at one of the hospitals and institutions within walking distance. So, the Brigham and Women's Hospital, Children's, Harvard Medical School, Simmons University, and I could go on. 95 St. and Longwood also enjoy a superior location to its own comp set. The buildings are, as you can see, at the sort of right outside the Longwood Medical Area, and their competition is set back further south. And so that gives the project an opportunity to excel in terms of occupancy and rental rates. I'll also note here that we believe in a post-pandemic urban environment. 24-hour security and a detailed plan for package deliveries are essential to operating the safe buildings and attracting tenants. Another shift we've been seeing and implementing is a shift from tower construction to lower cost stick over podium construction in order to mitigate the looming risk of rising construction costs. Well, there's a precedent in the neighborhood for tower construction, best exemplified by the Longwood to your left on this slide, which is a 147 unit, 13-story tower, and its neighbor on the right of the 95 St. rendering. 95 St. is going to be a 115 unit, 5-story stick over podium building. So 95 St. will have a 13% affordability component, serving residents earning 70% of AMI. So the lower costs associated with the stick over podium construction also help to make these much needed affordable units a reality. And I'd like to also point out while we have this image up and we're talking about equity and inclusion in housing, that it was important to our partners at the Boston Planning Department and to us that we activate and bring attention to St. Alphonsus Street, which has historically been dark at night and less prominent than its sister street at the corner, Tremont Street. So to that end, we designed the lobby in a way that brings 95 St. into the street and the community by being transparent with glass all around. And from the street, pedestrians can see into the courtyard. I don't know if you'll all be able to see that easily here, but you can download these slides later and take a look. So that further connects 95 St. And its community to the greater Longwood Medical Area and Mission Hill community. We're also noticing and employing a renewed focus on higher end exterior amenity spaces and unit interiors to accommodate residents who are spending more time at home. So we previously weren't paying a lot of attention to the roof deck, and now, as you can see from this excerpt from a presentation from an architect this January, we're planning for a nicer roof amenity that can be enjoyed during the shoulder months, and we'll be providing heating lamps, and it'll look and feel something like this, which is pretty exciting. Finally, we've recently also decided to invest more money in higher end finishes to make the kitchens and baths more inviting and homey. For example, the splashy island countertop, two-tone cabinets, tile backsplashes, and not only does this improve life as we're spending more time at home, but it will also help the building to compete for residents in a highly competitive post-COVID environment. Typically, the LMA operates at 95 to 98% occupancy, and there's not much of a need for a big marketing budget, but we're more challenged today than we've ever been before fighting for every quality tenant, and have had to double the marketing budget to include advertising dollars, enhance the quality of the project's website, and provide concessions and other incentives we've never needed to offer before in order to achieve a standard level of occupancy. Here are some additional photos of the first floor lobby and leasing lounge, as well as the living room and club room. Obviously, these won't get a lot of use this year, unfortunately. And I can talk a little bit about the Longwood, which is going to be benefiting from a few upgrades as well, thanks to the cross-collateralized project financing. Most relevant to 95 St. is an upgrade of the decaying balconies in the 1960s facade that you can see here. Our goal is to improve the views of the Longwood from 95 St. in order to support the lease up of that new building. So the white panels that you see here will be replaced with some darker colored vertical rails, as you can see here in this rendering. And the darker color plays a visual trick on the eye that allows you to see the view from and of the balconies through a more transparent lens. It makes the balconies and units feel bigger and nicer. The exposed slab will be painted a similar color to the masonry, allowing for the building to express a more vertical element, making the building look more contemporary and to feel lighter. So to summarize the key points of the presentation, the ways in which our focus is changing in a post-COVID world are as follows. When considering urban development, we're focusing on micro-locations that support walkability and safe and active work environments. And we've had to double our marketing budget to attract tenants, even in a unique urban micro-location like along the medical area. We're enhancing our outdoor amenity spaces to make them look better and to accommodate safe gathering for longer periods of time. And we're upgrading unit interiors to make staying at home a better experience. Upon stabilization of 95 St., we will operate the project the way we've developed it, with careful attention to the ways that we can make home safer and a better place to be in this changing post-COVID environment. Because at Wingate, it's all about home, which is our tagline, and I think a true reflection of our values. So thank you for letting me share a little bit about who we are, what we do, and how we do it. I'm happy to answer any questions anyone has an interest in raising here or elsewhere. I did not, like Sharon, put up my contact information, which was smart, but I'm pretty easy to track down if you just give a call to the main line at Wingate. And so I guess I'm passing the mic back to someone. I'm not sure who.
Thank you,
Brenda.
Elizabeth. Can you hear? Hi, can you hear me?
So sorry, everyone. Brenda is having difficulties. Elizabeth, I was going to ask, why don't you put your email in the chat for people? And I'm going to kick us off with Brenda's permission with some questions. I also did want to note Peter Scotti was supposed to be a member of our panel today to give you a perspective from a realtor who especially works in the commercial multifamily sector. He sent me some amazing analytic reports, which he only sent them to me recently, so they have not been linked in our documents. If anybody is interested in those reports, please email me. I will put my email in the chat as well. I haven't dived into them yet, but they look amazing. So there you go. So our first question from Jennifer Siciliano, has anyone, the state or other nonprofits, thought of providing funds to help housing cooperatives get off the ground? They provide affordability at the same time building community. And I've only looked at cooperatives. I've never thought about how you start one. I'm sure Brenda would have an answer. Oh, Sharon has an answer. Okay.
Oh, good. Can you hear me?
Okay, good, Brenda.
Oh, sorry. Can you hear me? I think I figured out my mic.
Yes.
I have a little bit of an echo. So we do have some co-ops in the state already, and I think Sharon was probably going to talk about a few of them. So they are a tool, and different funding sources like bond and other funding can be used to build and develop co-ops as well. So, but expanding it and bringing it to scale is definitely a good idea.
I was going to comment, one, dependent on the deed restrictions and the affordability of the co-ops and, available resources in Rhode Island. Having managed it in my other pastime with NEF, it was it wasn't as easy as the thought of it in the beginning was great, but as the terms started to come where the co-ops were to be formed, unless it's properly documented and you have a very solid plan, it can become a disaster because people don't understand the co-op, and so it's really important to make sure that it's well thought out. But I do know one of our colleagues, it's not a co-op, but they have other housing models where people are, sweat equity initiatives and different things where tenants help build their homes and programs such as that. But from a compliance perspective, the co-ops that I managed in Washington, D.C. or oversaw, it really, the concept was great, but I think it will take a lot of partnerships, working and legal documentation and making sure everyone involved really understands the concept and the purpose of the co-op in order for it to be successful.
Sharon, I think you raised important points, but I think, and I agree, and I think just kind of looking at other shared equity tools, maybe not only co-ops, but other ways that we can help kind of increase the supply, but also retain and increase local ownership of projects. But there are lots of tools out there, and we need to continue to expand their use in Rhode Island. Annette, can you see the next question?
Yeah, I haven't seen any, but I'm sure you have some queued up, Brenda.
So just, and I, again, apologize to everyone, all of the technology issues that I've been having. I had to shift locations, and I think that also made it a little more challenging. But so just to comment, and I'm sorry that Mr. Scotty wasn't able to join us, because I do want to kind of talk and would love to get Sharon and Elizabeth's perspective on kind of on the topic that he was going to talk about, which is the current real estate market. I mean, we already had an affordable housing problem, an affordability problem before COVID. COVID obviously has highlighted the issues, but as my colleagues know, we have very low vacancy rate. Home sale prices, even through COVID, have remained very strong, and just because of lack of inventory. So if Sharon or Elizabeth want to comment about kind of what they anticipate as the growing need and changing need. We are also seeing, particularly in the homeownership market, lots of people kind of coming in and buying up, particularly the second home market and other markets in the state as they try to move away from denser cities and towns. So anyway, just curious as to what you're hearing and seeing on the ground. And do you see some of these changes as permanent changes or likely permanent changes, or things that will change once we start to recover from the public health issues? So long question there, but love your reaction.
Sure. I can start sort of picking up on the market rate side of this because we were just talking about that, or I was just talking about that. So it's fresh in my mind that we're taking a hit to our rents that we weren't anticipating. Like I had mentioned, we're typically 95, 98% occupied, and we were assuming rents that are, we think are probably going to be 25% off the mark effective once we deliver the building. So that's a pretty unfortunate place to be in Boston. But I think that once we all get vaccinated and people feel comfortable living in cities, then we'll see a bit of an improvement there. But, you know, like I discussed in the presentation, I think, you know, when you're in the right location where, you know, we've got all of our residents walking to work because they're working at the hospitals, that sets us up nicely. But I think the rest of Boston is hurt really badly. I mean, you know, I think I mentioned Seaport, but that's, you know, I think their occupancy is across that market is probably 60%, where you're used to seeing that at, you know, close to 100 as well. And those rents were wild. So, you know, you're talking $4,200 a month for one bedroom. I see that for at least the next year, probably, you know, being closer to $3,000 a month. I mean, some of the deals they're offering are pretty exceptional. So it's giving a lot of people an interesting opportunity to live in places they wouldn't otherwise have been able to live, which is a good thing for them. It's tough as a landlord, obviously, when you know, weren't anticipating that at all. But you know, I will say on the affordable side and in terms of workforce housing that's in our portfolio, we've actually, like Sharon had said, you know, we really don't have a lot of bad debt in the portfolio. Folks have been doing an amazing job keeping up with their rents. Our management team has been doing an exceptional job meeting once a week, you know, from our president down to our management staff. Every single week, the whole group gets on the phone and talks about what kinds of, you know, things that municipalities are able to offer people in terms of support, financial support, what we're able to offer in terms of financial support. So, you know, rent forbearance, that kind of thing. And so while people might not be able to pay their rent today, 6 months from now, they'll be current. And so I think it's all about working together and spending just that much more time doing what we can do to help each other make things work. And, you know, again, like I said, our workforce housing portfolio and affordable housing portfolio, our residents and staff have been working really well together on that front.
And I wanted to comment on the acquisition piece of it, because I do know that maybe 2 years ago, Omni had submitted an offer on a parcel that was very affordable. We didn't get the LIHTC, we didn't get the 9% deal. And, you know, the requirements, I couldn't acquire the lot without having the award. And so now this particular owner is coming back to us. One person was able to hold their price because it's an elderly gentleman just trying to get rid of the vacant property and vacant lot. But the other person next to one of the properties, their price is like tripled, you know. So the market, the acquisition price is going to be significantly higher. And then as you're driving through and you're trying to identify lots, people are holding on to them because they think they're going to get more money, and some of the prices are very, very unreasonable. And in Rhode Island, when you're trying to develop, there's like a per unit acquisition price. I think it's like $21,000, or it's less than $30,000 per unit that they want you to acquire a particular development. So it's going to be very tough as we try to create more affordable units. I think the preservation side of it may be okay, but trying to acquire and build additional units is going to be a little bit more challenging because the TDC is going to go up and your budget's going to be shot, and you got all these other, you know, circumstances that you can't control with the pricing of lumber and cabinets and all that stuff. So I'm concerned. You know, I don't know how we're going to be able to add more units unless it's something that we already own.
Yeah, and do you mind if I? Oh,
yeah, go ahead.
I was just going to add to that briefly. I was telling Sharon earlier, we're looking at an acquisition in Boston and have been having conversations with, you know, the tax credit administrators, and I think, you know, they're willing to be flexible with certain assets. I think when it comes to, you know, development cost limits and things like that, because they're seeing what we're seeing, which is pricing's crazy. I mean, we made a tax credit contingent offer, and all cash buyers met us where we were at that number. And, and the property that we're looking at needs 90,000 a unit in CapEx. And, I think that the seller's trying to they don't want to do that work because they haven't done work for 20 years. And so now they're trying to sort of get the value of the property post-construction without doing the construction. And I wouldn't be surprised if the property actually traded and someone bought that deal. And the part that is unfortunate is I worry that the buyer of that asset's not going to put money back into it quickly enough, or maybe at all. And so, that's a problem for affordability.
And I think you raised some important points. And I'm particularly concerned kind of on the homeownership side and kind of trying to address equitable issues because inventory is so low, because we kind of see this outside influence of the Zoom towns and people buying up properties or, moving into their summer home, that's going to restrict supply even more. Are you seeing a lot of outside buyers, Sharon, coming into the field? Into the neighborhood?
In the residential area, but I do know for Omni's portfolio, I get at least 2 calls a week from people outside of the state asking me if I want to sell one of my buildings. They just they're just calling me like, oh, we see that. And I'm like, we're not selling right now. I can tell you, every high-rise building or elderly building that I have, or apartment building, I've had someone ask me to purchase, and they said, they said we can make a cash offer, we can do this, we can do that, and I'm like, wow, the nerve of these people. So some people are really trying to take advantage of it, but thankfully we're not that type of owner that's just rushing to sell. We really take pride in these assets, and it's a where that's our mission. So that's but other developers will probably sell. And I've actually received calls from realtors asking me if I wanted to buy someone else's an asset right now. And I'm like, yeah, no. So we have our hands full right now. So we want to create new, right? We don't, it's not in our best interest just to take over something that's existing. We want to create more opportunities, right? So that's the model that I have. So.
Yeah.
And to comment on that, we also, as want to build new. We're building new with Sharon, or hoping to, and that's great to be doing. I also think there's a threat that some housing might not be preserved because of things like what we just were talking about, and that really makes me worried. I mean, we're seeing that with the projects that Sharon and I are working on. That project just was basically neglected. And so, when we went through the RFP process, a number of developers came in and said, oh, we're going to preserve the building. And we said, no way. I mean, this isn't even remotely in good enough shape to keep it as it is. So out of 5 people or 6 groups, 5 or 6 groups, we were the only one to come up with a development plan, which we were surprised by. But it was good for us, I guess, because it was a better plan. And we won the RFP. But I think that you're having to replace housing that could have otherwise been preserved, you're just going one for one. So you're not expanding the portfolio of affordable housing in the country when that happens. And so preservation is something that we also focus on at Wingate. We're working on a 188 unit preservation project in Buffalo, New York. We're putting about $7.5 million worth of capital back into that project. We couldn't, it was actually a pretty complicated deal. We ended up doing it with Fannie Mae, which, if anyone ever wants to talk about that, that's really interesting because you would think it would be a tax credit deal, but it was not. But I won't go into detail on this because it takes too long.
Brenda, can I just make one point?
Yes,
because,
please.
Hearing Sharon and Elizabeth talk about this, it is reminding me of what we went through after the foreclosure crisis, because one of the ways the market creates naturally affordable housing is through people who flip homes and don't fix them up, or landlords who don't really keep up with their municipal code. So I think this brings back the point that it isn't just planning and zoning, code enforcement, also really has a role here. And when you get a call from somebody who is in a multifamily that is owned by maybe an out-of-state investor, maybe not, but who is complaining about things, you really need to get your code enforcement people out there, because we know that this is the way that the market retains some market affordability.
Yeah, no, good point. And, and tools that we already have in place, like rental registries and landlord registries and other things, are critical for cities and towns to stay on top of. I mean, we are hearing from colleagues across the country about kind of bigger corporate presence, buying up properties and losing local control. And for those of us who lived through the 2008 meltdown, we know how challenging that was, and it still is for a number of the neighborhoods that we work in and care about to recover as well. So, using tools like land trusts and shared equity models and other things and looking for ways to kind of keep ownership as local as we can in many cases, I think is also going to be critical as we try to recover from COVID. Annette, I know we're getting close to time. Are there any other questions in the chat?
No.
Okay, Sharon or Elizabeth or Annette, anyone like to, any final thoughts?
You're on mute, Sharon.
I think I've done it the whole time. So
good afternoon. I wanted to share, and I think this is a very important point, and I know Liz and our team went through this when we were selected to redevelop Barbara Jordan in Providence. One of the things that I think is very, very important, and we went through this exercise over a 2-year period almost, of really trying to engage the community. Rhode Island Housing had started the conversation, and we did not want to take for granted that Rhode Island Housing had already did the the community engagement. So It was very important. I'm familiar with the neighborhoods in Providence, but even if it was a neighborhood outside of Providence, a neighborhood that I was familiar with, I think one thing that I did learn is that that's a tool that is very important to engage the neighbors, speak with the city officials, see what their feel is for your project before you make the proposal, engage the community several times, not just one meeting, but multiple times, trying to engage the community, because if they at least feel they're being heard, and you're not able to do everything that the town wants or everything that the neighbors want, but if you meet them in the middle, because at the end of the day, people need housing, and it's very important for people to hopefully get housing outside of the urban corridor, because we're very proud of the work that we do, and that's something that I think it's important for people who may not have affordable housing to give it a chance and to really understand that the product that we have, affordable housing developers, we're local. That's our mission. We're committed to the residents that we serve, and it's only in our best interest to help the residents be successful tenants in whatever town they live in. So I just wanted to just share that, because I think it's very important, and especially with this COVID pandemic. And I think we should just be open-minded to the opportunities that hopefully will come to residents in the future.
Thank you, Sharon. Well said. And for those who are from cities and towns on the call, I mean, there are a lot of those local partners, like groups like Sharon, like other community development corporations, your public housing authority, the HESs, we've talked about the health equity zones and others, many of whom are focusing on housing issues. So there's lots of partners that local communities can work with to try to address local needs. So Elizabeth, I didn't mean to cut you off. Were you trying to say something too? Nope.
No, you weren't cutting me off. I was only going to make one comment that, I think Sharon's completely right. I think that's something that people really need to continue to stay, to be aware of, and they really need to reach out to folks like Sharon, and to make those projects happen, because they're important. Because otherwise, you have housing like Barbara Jordan today it's not usable, but soon it will be, and it will look as beautiful as, you know, the renderings that Sharon had put in front of everyone. So what we're doing is really important work, and you know, I agree with what Sharon had said.
Well, again, thank you, ladies, for joining us. Thank you for all of the participants. And again, thanks to our session sponsor. And I thank you for your time.
Thank you.
Bye-bye now.